I'm so excited to be introducing Myra Slayton today. She is a fabulous SLP who's going to be talking with us about a topic that I know a lot of the SLP Now members are always asking about. They're always asking about ideas and strategies and tips for to help students working on fluency goals. So I'm so excited to have you. I feel like you're going to be a celebrity in the membership for sure, because I feel like this is an area that so many SLPs struggle with, because it's lower incidence and there's so much that goes into it. So I'm really excited to hear from you about that. But before we dive into all of the good fluency stuff, I'd love to hear a little bit more about you, as just where you're from and where you went to school and how you got to be an SLP.
Okay. I am from a very, very small town in rural Alabama. I got my bachelor's degree at the University of Alabama, and then I got my master's degree from the University of South Alabama in Mobile. And once I made it to Mobile, I liked the beach so much that I just stayed. So it's been wonderful. I did work for a year in Atlanta for a contract therapy company, and then I've been in the schools the rest of the time. I kind of became an SLP by accident, if that's a thing. I was in college and I was halfway to a 5-year MBA, which guaranteed a 6-figure salary upon graduation. And I was in my second or third semester of courses, and I went, this is not what I want to do with my life. I mean, I could do it every day, I really could, but I would hate it. And a roommate, a suite mate of mine in the dorms at that time, was in the SLP program, and she was prepping an activity for clinic, and I sat down to cut out some things that she had colored, and we started talking, and she said, you know, you should really talk to my advisor. I think you would really like this profession. And so I did, and I changed my major halfway through my college career and became an SLP instead. And I'm having a lot more fun than I would have had. Oh, they started talking about a Wall Street Journal subscription, and I went, wait, I'm out. I can't.
Oh, that is amazing. And I feel like I had a similar story too, where I was tracked to like go get a PhD in psychology, but then I also met someone who was just doing like a random SLP thing, and I was like, wait, what is this? So I think it's funny how we both kind of were like, oh, we're doing this? Oh, wait, just kidding.
Yes.
Because it's such an awesome career, and like there's all of the amazing things that we get to do. So what's your caseload like now?
Right now, I've taken a new position with my district, and I have 22 students in alternative education settings. They either have autism with associated behaviors that require like an ABA type approach to instruction for both behavior and academics, or they are on a placement because they were not able to maintain appropriate behaviors in the typical school setting. So I work elementary, middle, and high school, and I have 22 students right
now. Okay, so that's a smaller caseload, but that's not an easy caseload.
No, not at all. It's very challenging. I'm fortunate in that I do have the opportunity to work individually with all of my students. My principal supports that. My district supports that, because they understand that these are children who can't function in a typical classroom setting, so why would they be able to function in a typical SLP kind of therapy session? So that's been wonderful, but the amount of planning and the amount of just programming for all the AAC devices and the different visuals that I have to get together, it's very labor intensive, even though it's not necessarily as, I guess, therapy intensive as some other jobs that I've had. And I'm about 5 years removed from a setting where I had almost 90 kids on my caseload, and I was one of 2 SLPs for a bustling, growing school district without administrative support. So the contrast is just amazing, and I love my job.
Yeah. So how did you get to that Because I know there are a lot of us who, and this is a little off topic, but I think it's so important. Because there's a lot of us who are in jobs where we have really high caseloads and we don't feel like we have support, things like that. How did you navigate kind of going to your ideal caseload? Were you able to just do it in 1 year, or what did that look like?
No, it was definitely a process and not always a pleasant one. I did have to change school districts. I will spare you the details, but I finally came to a point with the district I was in where I said, okay, there's someone out there who could do this job and not be bogged down by all of the extra stuff, the administrative criticism and all of those things, but that person is no longer me. So I need to step away from this job, even though I've been here for 7 years and it was a good school. There were great teachers there who were doing great things for kids. It just wasn't my job anymore, and I could feel that. So I let that go, and I went back into an inner city type setting. I was really nervous about it, but it was where I was supposed to be. It was where God placed me. And I did that for 3 years, and last year they started an elementary alternative school, and I volunteered to take that on in addition to the school that I was already serving. And once I did that, in December, our lead SLP came to me, and she said, if I make a position that is just the behavior schools and behavior units, will you take it? And I said, yes, no problem.
Oh my gosh.
So it just kind of evolved for me. From being willing to take a risk and let go of a good thing so that I could have a great one.
Yeah. Wow. That's amazing. So props to you for having the courage to go out and do that too. That's so awesome. And it feels like you kind of just channeled your perfect job by taking those steps.
Yes.
That's amazing. And I feel like I want to hear all about your behavior and AAC stuff, but that might have to be a whole other talk. But because today we're talking about a fluency case that you got to tackle. So can you tell us a little bit about how that went about and just a little bit about the situation?
Okay. Well, it was a student, the particular student who was so challenging for me was on the autism spectrum, but was mainstreamed into a classroom, high functioning, did really well. And I had him for a year with no stuttering behaviors whatsoever. And some things kind of changed with his health status. I think he started having some seizures. And he was no longer able to be in the home with his mom, and his grandparents took him and kind of went into a foster type setting with grandparents as the primary caregiver. And all of that happened over the summer. So when he came back in the fall, he had been through some trauma, he had been through some health status changes, and he was stuttering severely. Secondary characteristics all over the place. We were repeating beginning sounds, middle sounds, some word endings, so I think there was probably a little bit of a neurogenic component, but it went from non-existent to severe in about 3 months' time over the summer.
Wow.
And the hard thing with this particular student was, one, of course he's aware, but he doesn't have strong language skills. He doesn't follow directions really, really well. He doesn't do metacognitive skills really well, very concrete learner. So instead of my traditional way of just kind of diving in and handling a fluency problem and being able to go straight to the stuttering behaviors, I had to lay a lot of groundwork with him. Had to do a lot of visual hands-on type activities with your speech machine and belly breathing and all of those things. And the belly breathing turned out to be kind of the key for him. Once he realized that he could control his voice, that he could make it do what he wanted for the most part, that decreased the incidence of his stuttering moments to the point that we could then talk about them and their intensity and help him kind of learn how to stutter more easily. So it was very challenging, but it was a fun process too. I really had to use some clinical judgment, which you don't always get to do very well. And he was a dream to work with because he was aware enough that it was even more socially awkward than he was, than he traditionally had been, that he was motivated, I guess, to try the things that I asked him to try. And he was such a sweet kid.
Aw, that's amazing. So how did you go about that clinical problem solving piece? Because I feel like a lot of us would get a kid like that and be like, where do we even start? Like, how did you start navigating that? Had you had experience with Fluency in the past, or how did you figure out?
I had a few students in the past who had stuttered, and I had ordered the Color Me Fluent curriculum from Super Duper. And I did what I always do when I order curriculum. I sat down, I read the manual, and I decided for myself, okay, these things are things that I think will work really well, and these things are things that I might want to skip. I knew that approach was right for him because there were so many hands-on concrete things. Using a slinky to talk about stretchy speech, and it just gave him a tactile cue on top of me telling him verbally, and it was very visual. And so I kind of just sat down. First I went, oh my gosh, how do I help him? Because it was painful to watch. And then you just kind of give yourself a pep talk and you go, okay, you know how to do this. Fluency is a speech disorder and we know how to treat it. So go out there and find the treatments, and don't be afraid to try something. It may be a dumpster fire for a session or two. It really might be.
Yep.
But eventually you're going to find what works. The things that you know about the kid, he needs visuals, he needs concrete hands-on. These are all the things. And then I just looked for what the activities that fit his needs. And we struggled. It was not a perfect process. It's not like Super Therapist went in and she solved all the world's problems in a school year. It took 2 years. It did take 2 school years, but just step by step. And I was also not afraid to engage in reflective practice. When I had that dumpster fire day, I sat down at my desk at the end of the day. What went well? What didn't go so well? What did I do that was not right for the situation? What breakdown did he have that I need to repair next time? You have to ask yourself those questions, and you can't be afraid of failure. You can't.
Mm-hmm. Yeah, and it's like there's failure on the way to success. So like if there was just like do this and they're cured, then then we wouldn't have a job anymore, right? So it's just that problem solving. And I think that's I absolutely love your mindset about this. I think it's amazing, and I feel like you'd be with that mindset, you can tackle any clinical problem, and you'll figure it out. Like eventually you will get it. And I think that's so amazing, and something that I know that I've definitely worked towards and I can constantly continue to work on, but that's so inspiring to me. So thank you for sharing that. And so what do you think? So you mentioned some of the things that you thought worked really well, like your reflective practice. And when you were doing that, is it just something that you were kind of thinking about, or do you journal it, or is it in your notes, or how do you structure that?
Sometimes I do both.
Mm-hmm.
A lot of times this is maybe too much information. My best thinking comes in the shower in the morning when I'm getting ready for work. Yeah. I don't know why, but
it's a thing.
Okay, I'm so glad somebody else said that. But very often, yes, I'd had that sit down at my desk and I thought through it in my head. And if I needed other materials, if I came up with like clinical questions that I needed to look up an article or two, or I needed to research and find a different method of instruction, I jotted that down because I'm great with ideas, not always great with follow through, but if I write it down, it's going to happen. So yeah, I did write down those steps, but a lot of it was just reflecting, okay, it's Wednesday and I'm in the shower and I know he's my 4th session of the day. What are we going to do today? I know what I wrote down in my lesson plans and I know what I've planned for the session, but based on what happened on Monday, is that really what we're going to do today? And a lot of it was just in my head with, a few notes.
Yeah.
Here.
Yeah. No, that's the perfect combination, I think. And it's just so, and sometimes like we're just, because if we think about it too much and put too much on it, then we just get bogged down. And I think that's why the shower piece works, because you're kind of, I don't know, you're just doing your routine, and then it's kind of going around in the background, and then it pops up and it's like, Eureka, that's
Yes.
it.
You're so right.
Yeah, awesome. So you told us, and going back to the things that worked really well, so it sounds like reflection was a huge part of that. And you used some of those curriculum pieces like Color Me Fluent, and I think you said Focus on Fluency too?
Yes, Focus on Fluency is another box curriculum.
Mm-hmm.
A box is never 100% of the answer, but there are really often some very great tools. And language and ways to talk about fluency that I was not smart enough to come up with on my own. And that's okay. It's okay that other people are smarter than me and they figured that out, because it saved me time. But Focus on Fluency was really nice. It has a really nice like magnetic board with the person and the anatomy, so that, and then the magnetic pieces of the anatomy that you can stick on when you're talking about the speech machine. It really broke down the pathway to speech, I guess you could say, with respiration and phonation and articulation in a nice way that was easy to understand. So I used those pieces, and then the pieces from Color Me Fluent where we talked about, it really helped me help him set goals for himself, because it talks about that we have green speech, and everybody has that sometimes, and it's good and fluent. And then there's red speech, which is stuttering, which happens to everybody sometimes, just some people more often, and it lasts longer. But what we were shooting for in therapy was not green speech. It was something that the program calls orange speech, meaning that it's controlled, but it's not 100% easy all the time. It's just not red. And so we want as much of our speech as we can have orange to be orange. And so there were great visual cues with that. I could show a green card, orange card, red card to let him know what he was doing well and what he was not doing so well, made him less dependent on my verbal cues, which is always a good thing.
I love that. Speak my language.
And then that's where I got the Slinky idea. Focus on Fluency has a game board activity that was really nice, where you just play a game together, and each square has a different type of speech. It might be spooky speech or loud speech or whisper voice. Like, there were just lots of different speech tasks. And so as you play the game, when you land on that square, there's a task card, and you have to complete it in the voice that's described on the. And so you might have to ask for a drink of water in a spooky voice, or, let me think. Oh, or tell someone to be quiet, but in a yelling voice. Like, sometimes there's really high combinations. But that was really instrumental, I think, in helping him feel like I have control and I can use my voice in different ways. And some of them were like purposeful stuttering types tasks where you did do it with bumpy speech, and then others you were shooting for fluent speech. But there were enough of the other funny tasks, I guess, mixed in that it was really engaging and entertaining for him, but it still got us where we needed to be. So I used all of that just kind of in a sequence. I used the guidelines from the programs pretty well, for the step-by-step. There was a really nice activity where I wrote the different progressive relaxation kind of tasks. Popsicle sticks, and then he just pulled them out. Like, we did 3 at the beginning of each session, 3 relaxation activities. And he would just pull 3 popsicle sticks out, and we would do those 3 really quick. It's kind of a warm-up before we got into therapy. So that was good, too, and really fun. I'm trying to think if there were any other things that were just really helpful. But that's all that I remember pulling from the programs. And then, like I said, I used the guidelines that were there. And then as he got into more generalizing kinds of tasks, we pulled in some literacy-based therapy and even some social skills, because, of course, he was on the spectrum. And so we could work it in at the same time.
Yeah, that's great, because it's all in context. It's all happening together. So that's a great way to pull it all together and make it more meaningful.
Yes, close to the end of the second year together, there was a new student that came to our school, and it's very difficult to describe his speech pattern to me because it was almost like cluttering, but he had some mental health, like personality disorder kinds of traits, and where we had more than one personality sometimes trying to communicate at the same time, if that makes sense.
Huh.
And so it was like a real press for speech, and everything came out kind of jumbled in on top of itself just because of, I think, the mental health issues that were in the background there.
Huh.
So,
Yeah.
but I put them in a group together. I kind of had to because they were in the same grade and they had the same schedule, and so it worked. But the really nice thing about it was I got to see the student who I had been working with for a while come in and instruct the other student, no, wait, you've got to slow down. You're not breathing. You have to breathe like this. So he got an opportunity to share what he had already learned, and then they got the opportunity to progress together, which was nice.
I love when that happens. And it's so empowering to the student who is doing the teaching.
Yes.
That's so cool. And then, so you talked about some of the things that didn't work, but in your article, you mentioned that you started working with the student in a group.
Yes, I did. And there were some students who did have behavior issues, and so they weren't always the kindest group members.
Mm-hmm.
And also, a couple of them were, okay, let me be tactful. They were accustomed to coming to speech to play a game,
Mm-hmm.
and not necessarily being real cognizant of their goals all the time. And so they tried to drive the session because they wanted to play a particular game. And so I spent so much time managing behavior that this particular student and I didn't get to the point that we really needed to. So I've changed my grouping a little bit. You have to do that sometimes.
Yeah. Yeah. And just being able to think of that as like, if a student isn't progressing the way that we want them to, considering that as a solution. And I know.
And sometimes it makes your life harder. Sometimes that means you don't get your planning time every day, or whatever. But I've just always kind of been in the mindset that if I don't do it for that student, no one else is going to. So I will figure out a way to make it work.
Mm-hmm. Yeah, no, that's so true. And I think that we can, like, it's so easy to say, like, I can't change it. I can't change it. But if we stop that narrative and we start thinking about, okay, so this would benefit the student more, like, how can I make it happen? And the creative options just start to appear once we start doing that, I feel like. So it doesn't always mean that we have to skip our lunch and all of our planning time. And sometimes that is the case, but sometimes there is just another solution out there. And I think just being open to that makes a really big difference. And it sounds like you're really awesome at that too.
Oh, sure. Sometimes it's just, okay, this kid causes a behavior problem, but I think it's because he's in the end stages of carrying over this articulation skill, and we have this R in one context that's not right. And so if I just grab him at a backpack time, either beginning of the day or end of the day, for 5 minutes, 5 days a week, look, he's out of that group, so that's not a problem. Now I only have to worry about student B. And there were only 3 people in the group, so then I'll have student C right where I want him. So you find another place for student B to go, and all of a sudden you've opened up a whole time block to do individual therapy, which you didn't think was possible.
Yeah. Yeah, and then that benefits the student too, because then he's going to be done. He's going to be able to graduate sooner, and
yes,
like it's just win-win-wins all around, right?
Right.
Okay, awesome. And you told us a little bit about the end result, but when you started working with this kid, did you have any idea about like how long it would be, or was the process what you expected it to be? Like,
it's always, to me, difficult to predict outcomes.
Yes.
And with
100%.
him, it was especially difficult because we're in this situation where grandparents are caregivers, but is mom still in the picture? Does she want to be in the picture? Is she going to try to take him back and put him in an unstable home again? Or when she takes him back, is it going to be a more stable situation? And his home support was so unpredictable that I dared not, make a determination about especially about fluency, because every trauma is going to be a new set of behaviors possibly. So no, I had no idea how it was going to go. I was just along for the ride, and I made sure that his teachers, I can't make them do anything in their classroom that they don't want to do, and I understand that, but I let them know this is what he needs in order to be successful.
Yeah.
And then you have to trust your coworkers and know that they are good-willed individuals. They don't wake up every day going, how can I shortchange this student? So even if they make a mistake, even if they don't do what you would do in their situation, they're still working with his best interests. So you let them know and you communicate, and I made school as safe a place as I could for him so that maybe bumps at home wouldn't be such a hard thing. And then I just trusted the process. I think that's something that it has taken me some time in my professional life to kind of come to grips with. These are speech disorders and we know how to treat them. It's not a mystery. There really is evidence out there. And as I've gotten better at looking for that evidence, I've become a lot more confident in trusting the process of speech therapy and believing that what I'm going to do is going to be effective.
Yeah. Yeah. And if that one technique doesn't work, there's another one out there. There's new research coming every month. So how do you tackle the research side of things on top of all of the other things you're doing? Like, how do you make that happen?
Well, thankfully, there are lovely people like you who do some of the legwork for me. I've been fortunate. My husband's in school to be a nurse practitioner at the moment. He's about to be finished, and I'm kind of sad about that. So I've had like unlimited access to a biomedical library databases for free. And so I have taken advantage of that. And even if it's just a couple quick downloads or I add this to my Google Drive, even if it's only the abstract, that's okay. That gives me what I need. And so I have really been kind of a nerd about it, because he'll come in, my husband will come in, my kids are like, Mommy, what are you doing? I'm like, oh, I'm just downloading a couple of articles, no big deal, I'm going to read them later. And so when I have time, although I have 4 kids, so I don't have a ton of time, I do kind of tuck those things away, and it's usually whatever's pressing at the moment. If I've got somebody who's breaking down because this fluency technique didn't work for them, I'm just going to do a quick keyword, and I'm going to throw the abstracts into my Google Drive, and I'm going to sit down just as I have time. If that's 5 minutes here, if I can eat lunch at my desk, and kind of peruse it, and you just kind of cram it in wherever you can, or I do.
Yeah. And it's nice because the most pressing issues will rise to the top, and that'll inspire you to kind of look at that first, and that's kind of how you navigate it.
I've also joined some Facebook groups that I found really helpful.
Yeah, there's some really great ones out there.
I haven't bitten the bullet and joined the Informed SLP yet, but I appreciate the little tidbits that they put out there for free. And I've joined their group, and then I've also built a relationship with faculty at our local university, because I went to school there, and some of my professors are still there. So they're really easy to reach out to, and hey, I'm having this problem. Usually I do it more for language than anything else, because I have the best relationship with the professor who teaches child language.
Wow, that's amazing.
Yeah, and I'm just like, hey, Dr. Beverly, I've got this issue. Can you point me to some great articles? And she'll send me a couple of citations, and, I can get to it when I get to it. But she's really kind to do that for me.
Yeah, that's amazing. And using that network, because you're not in it alone. Like, there's all of these other.
There are 75 other SLPs in my district now. I work for the largest school district in the state of Alabama. So we have about 75 SLPs, and that's a great network too. I can always reach out to somebody if I have an issue. We have a little email group going all the time, and if you have a question, you just kind of throw it out there, and someone's got a suggestion. So that's
That's awesome. That's so cool. Well, I feel like I learned a lot today. So thank you so much for sharing all of these amazing tidbits. And I feel like you had a perfect combination of really practical things that we could do, but also just the stuff that's harder to get at. Like, how do you actually do this in the real world when there's all of these different things flying your way? So I'm so impressed by your mindset and how you approached situations like that.
Well,
So
thank
inspiring.
you. I'm a firm believer that people do what they want to do. I mean,
Mm-hmm.
that's true. You prioritize and you actually do the things that you truly want to do. Not the things
Yeah.
you say you want to do, but the ones you truly want to do. So I
Mm-hmm.
try to be sure that I'm treating every child that I serve the way I would want my own child treated if they needed that service.
Yeah, that's so huge. So was there anything else that you wanted to share?
No, I don't think so.
No?
I'm really enjoying the membership and the community and all of that.
Oh,
And I appreciate the opportunity to share. Everybody, even though there's 75 SLPs here, most of them were trained by the same university system. So we all kind of do things the same. So it's nice to
oh,
have like an outlet for something kind of outside of my comfort zone where other people have different ideas. So that's been really, really nice. Thank you.
yeah. And thank you. This was amazing. So helpful. I know everyone will get a lot of value out of this. And thank you I can't imagine how busy you are with the school caseload and 4 kids and just life. Like that must be such a full plate. So thank you so much for sharing your time with us. And I'm sure we'll hear more from you in the future.
All right.
Thank
Thanks,
you.
Marisha.